Hi folks, I'm the Old Physio. If you're a physical therapist and you only read one clinical practice guideline this year, make it this one. The 2021 JOSPT Clinical Practice Guideline on Low Back Pain is one of the best summaries of what the evidence actually says. And after reading through it, here are the 10 biggest takeaways every PT should know. Number 1. Exercise is still king. If you're looking for the intervention with the strongest evidence, it's exercise. Not a specific exercise, just exercise that fits the patient. Walking, strengthening, aerobic training, motor control exercises, it all has a place. The goal isn't finding the perfect exercise. It's getting your patient moving consistently. Number 2, stop treating every back pain patient the same. Not all low back pain is created equal. Someone with acute back pain isn't the same as someone with chronic pain. A patient with radiating symptoms isn't the same as someone with movement coordination impairments. The guideline emphasizes classification-based care. Your treatment should match the person sitting in front of you. Number 3, education is treatment. This isn't something you save for the last minute of the session. Helping patients understand that their spine is strong, that movement is safe, and that pain doesn't always equal damage can completely change how they recover. Sometimes the conversation is just as powerful as the exercise program. Number 4, don't ignore the biopsychosocial side of pain. For chronic low back pain, muscles and joints are only part of the picture. Fear avoidance, catastrophizing, anxiety, depression, low confidence, and unhelpful beliefs about pain all influence outcomes. If you're only treating tissues, you're probably missing a big piece of the puzzle. Number 5, manual therapy still has value, but it's not the main event. Manipulations and mobilizations can absolutely help reduce pain, especially in the short term, but the evidence is pretty clear. They work best when they're combined with exercise. Think of manual therapy as creating an opportunity for movement, not replacing movement. Number 6, keep people active. Remember when patients were told to stay in bed for back pain? Thankfully, we've moved on from that. The guideline encourages patients to stay as active as possible and return to normal activities as symptoms allow. Movement helps people recover. Avoiding movement often keeps people stuck. Number 7, core stabilization isn't the answer for everyone. Motor control exercises absolutely have a place, but not every patient needs bird dogs, dead bugs, and planks. These exercises seem to work best for people with movement coordination impairments, not as a one-size-fits-all solution. Number 8, walking is incredibly underrated. Sometimes we overcomplicate things. Walking and other forms of aerobic exercise consistently improve pain and function, especially for people with persistent low back pain. It doesn't always have to be fancy to be effective. Number 9, passive treatments shouldn't be your entire plan of care. Heat, ultrasound, TENS, massage, they may help some patients feel better temporarily, but none of them should replace active rehabilitation. The patient should be doing most of the work, not the treatment table. And number 10, clinical reasoning beats protocols every single time. This guideline doesn't say there's one magic exercise or one perfect manual therapy technique. Instead, it reinforces that the best physical therapists evaluate the patient, identify what's driving their symptoms, address barriers to recovery, educate them, prescribe meaningful exercise, and help them become independent. And honestly, that's my biggest takeaway from the entire guideline. Evidence-based practice isn't about memorizing the newest technique. It's about making better decisions for the person in front of you. If you're a PT student or a new grad, spend less time looking for the magic exercise and more time becoming an expert clinical thinker. That's what separates good physical therapists from great ones. Thanks for watching. Please like, follow, and share with your coworkers and classmates.